So this is a multiple area combined mobility test. It's called the HISL, and HISL stands for hip, innominate, sacrum, and lumbar spine. And so it's a test of hip flexion, posterior rotation of the sacrum, or of the innominate, then the sacrum, and then lumbar flexion. So this motion with hip flexion should occur in a nice smooth fashion. And my hand, I'm going to have my patient laying on my hand where I can feel innominate by feeling the PSIS, I can feel the sacrum, and my fingertips are in the lower lumbar spine. So I'm feeling for a nice smooth transition as the hip is flexed and motion is flexing through that entire pelvic complex. Scoot just a little toward me. So I have my patient in this kind of 90-degree position, and I'm just going to sneak my hand underneath so that my fingertips can feel lumbar spine, and I can feel that the PSIS, sacrum, and lumbar spine. From 90 degrees, I should have about another 20 degrees of hip flexion before the innominate moves, and then I should feel a nice smooth about 20 degrees of further motion before the sacrum moves, and then 20 degrees before the lumbar spine moves. What I'm really feeling for is similar excursion where I feel from here, I feel hip, innominate, sacrum, lumbar spine. So I would say, we have a nice smooth amount of hip flexion. The innominate picks up pretty quickly. The sacrum is occurring a little early in the motion, and then I can feel lumbar spine nice and smooth. So there might be a slight amount of hypomobility in the sacroiliac joint in this case, but there's multiple variations of what you might feel with this. A common thing might be you get a lot of hip flexion before innominate moves, and then you hit a hard limitation, and the innominate needs a lot of extra overpressure to flex. So we kind of have a relative hypermobility of the hip and hypomobility of the innominate, a common occurrence when you have anterior hip impingement kind of situation. But the HISL is hip, innominate, sacrum, lumbar spine. From 90 degrees, there should be a nice smooth, maybe 20, 20, 20, before you get hip, innominate, sacrum, and then lumbar spine starts to flex.